Okay, I'm Dr. Az. I'm a member of the Royal College of Surgeons, Edinburgh, and I'm here to help you to pass your OSCE. So if you are trying to follow all the information here in this channel, you can subscribe to it so you can get all the new stations here. After a while, you will find all the stations of the examination here. This is an updated channel, so we are going to add all the new stations with time. Okay, so many of you asked for the this is the bell if you want to know if anything new came, you can make it working. Okay, anyway, the many of you asked for the clinical stations, and the clinical stations are more in number. Okay, and there is a wide variety, wide range of clinical stations, okay, in the exam. So most of the practicing doctors pass in the clinical, and unfortunately they fail in the basic stations. The number of the basic stations is less, so you need to pass all the stations or most of them. If you fail one of the basic stations, you may still pass if they are still 18. But in the clinical uh, part, you may lose 2 stations and still pass the exam. Okay, so anyway, we are going to start the clinical part or clinical stations of the exam, and we are going to start with the station of the phone call. In the channel, you are going to find all the phone call stations in one list, so you will not need to seek for it anywhere else. And there are certain scenarios that will show in the exam. You want to know them all. Well, there is a certain way in which you should manage this part of the examination. If you know the way, you can do it. If you do not know the way, you will not do it. Okay? So let us start with number one. Number one scenario, usually in the phone call stations, they are going to give you a file, okay? And that file will contain information about a patient. Well, and in a paper or outside on the door of the station or of the room, they are going to ask you what they want. Maybe it is, please call the consultant of so and so to refer him a patient. Call your senior about a post-operative patient. Discuss with this patient a cancer, like this. So focus outside for the question. Then you will find it is an open book exam. In the phone call, it's an open book exam. You have all the information. You want to mention them in the right way. So it's an attitude station, not information station, because all the information is there already. So you do not need to get anything from your head. Fine. And if you know the way, it is a guaranteed station. You can get the full mark. Fine. So the first station that we are going to start with, the scenario will look like this. They are going to ask you to refer this patient, refer to a hepatobiliary consultant. Okay, this is the one who are going to call. This is the question. Fine. Then what are you going to find in the file? You are going to find some information. The patient who is cholecystectomy post lab chole, lab chole, yes, lab chole, as I remember, and his post laparoscopic cholecystectomy 4 days ago. Okay, this is the first information. Fine. You are going to find in the file that this patient has a complaint now in the 4th day of an abdominal pain. Okay, this is his complaint. It's a clinical scenario. Okay, Then you are going to tell that, they are going to tell you in the file that the one who has seen the patient noticed a bile in the drain. Okay, and you are going to find also, it's a file, it's full of information. You do not need all that information, you need just a piece of it. Okay, so you are going to find in the on examination, you are going to find that this patient's pulse rate is high, is tachycardic, and you are going to find that he's pyrexial. Yes, they are going to give you the temperature of 39 like this, but he's febrile. Okay, you are going to find him slightly jaundiced. Okay, and you are going to find that his abdomen is lax, so there is no guarding there. Fine. Then you are going to find the labs. You are going to look at the labs, and at the labs you are going to find that this patient's bilirubin is high. Fine. You are going to find that his total leukocyte count is high. CRP is high, so the inflammatory markers are high, and you are going to then tell about your radiological investigations, as this is a hepatobiliary consultant, so it is ultrasound here you are going to do, and you found free fluid. Okay, all this is given in the file. Remember, you do not need to tell anything from your mind. Fine. Okay, so what else, what information you are going to tell? You are going to tell about that leak from the drain. So these are the information, this is the data that you are going to find. Fine. So let us go to the station now. They gave you maybe 9 minutes. You read all the file. If you know the station from here before, you do not need to take all that time. You want to prepare your answers, but you read the file, you knew everything, you knew that is a referral to a hepatobiliary consultant. You are going to remember which station they are talking about. Okay, so let us start the station now. Okay, you are going to make a call. This is the first step. For my examination, for example, there was a phone. I was in a separate room, and I'm calling the consultant in another room. They are giving me a number. I'm going to press the number. The consultant will reply there. He's the examiner in this case. Okay. In some parts of the wall, they are going to put a chair in both sides of a sheet, and the consultant behind the sheet, and you are in the other side of the sheet. So it doesn't matter. It is same. The file is in front of you all the time. You do not need it, but it is there. And the consultant or the one who are you referring the patient to is not seeing you. Okay. So you are going to call, ideally, and you are going to make the first step. What is the first step here? The first step is that you are going to say hello. Okay, I am, you tell your name, real name. Okay, for example, I'm Dr. Az. Okay, and you are going to tell this is your name. You are going to tell your position. Okay, for example, senior house officer. They are going to write that for you in the file, in the question outside. In the question of the station, you are the senior house officer who is, or you are the ST1 who is. You are going to tell this as it is. Okay, and you are going to tell him that you are working for Dr. your senior, your consultant. Usually his name is Dr. Black, but whatever the name that is written for you in the file, you are going to say. So the name of the senior. Okay, well, so till this point here, you are doing fine. Okay, so this is the first sentence. Hello, I'm Dr. Rezi. I'm a senior house officer, and I'm working for Dr. Black. Okay, or Mr. Black if he's a surgeon. I'm working for his plaque. Sometimes they may tell you that this patient is in this hospital, but this did not happen in my examination. So the hospital, you do not know about the hospital. There is a hospital, no name. This doctor you are consulting is in another hospital, so you can tell that in this hospital. Hospital name if you want to tell, but usually it is not there. This is the first part finished. Okay, this is the first thing you are telling about yourself, about your position, and about your consultant and hospital. You are identifying yourself. The second part that you are going to say this, since the other person in the other side of the phone picked up the phone, you are going to say this: hello, I'm blah blah blah. Okay, the second part that you are going to tell here is that you are going to tell the purpose of your call briefly. This is brief. Okay, so what is the purpose of your call? You are going to say that I'm calling, okay, to, you have to tell your purpose. So I'm calling to speak to Mr. or Dr. so and so. This will be given to you. If no name given to you, you are going to tell that I'm calling to speak to the hepatobiliary consultant. Okay, if there is no name, if there is name, you are going to mention it, to ask and advice about a patient. This is a brief, so you are not going to tell the clinical scenario here. I'm calling to speak to Mr. So-and-so, a hepatobiliary consultant, to ask and advise about a patient. Okay, this is the second part. How can you close the second part about your purpose of call? Can I check that I'm speaking to Mr. So-and-so? Can I check? Always do this, okay? Can I check that I'm speaking to blah blah blah, the one who is there on the other side? Okay, so this is the second part. First part you told about yourself. Second part you told the purpose briefly. Why are you calling? And in that part here, finally you are asking about who is there. Is that the person you want or not? Okay, he's a consultant. He is not going to tell you that yes, I'm so and so. He's going to pass to the third part of the station. What is the third part of the station? The one old consultant angry man there who is is feeling bored of you and waiting for your referral of the patient, is going to tell you, he's not going to tell you that yes, I'm Mr. Black or Mr. John. No, he's going to tell you that summarize your case. Summarize your case. This is his response. This is the green light that you should continue or tell about the details now, after this permission, his permission for the hearing of what you are going to say. Okay, so now you are going to go, just go. Okay, so the fourth step here is that you are going to tell about your patient. What are you going to tell about your patient? Okay, you are going to tell that Mr. blah blah blah, whoever he is so and so years old. Okay, and you are going to tell his situation before the operation, was fit before the operation. Here, what is the operation? You are going to tell about the operation. It is lab chole, right? Underwent a lab chole 4 days ago. Okay. Well, this is the patient. Mr. So-and-so is so-and-so years old, previously fit and well, who underwent lab chole, laparoscopic cholecystectomy 4 days ago. This is your patient. Okay, now he has an idea about the patient. Okay, so this is the first step. The second step, you gave a brief about the patient and what type of operation he has undergone. Okay, now as you are doing any clinical clerking, okay, you are going to the complaint. You are going to tell him that this patient has an abdominal pain. This is the main complaint. Okay, you are going to tell him he's a hepatobiliary surgeon. You are going to tell him that we have noticed bile in drain. So these are the complaint part and your observation also. Well, the third part, as usual, you are going to tell about your examination. Okay, on examination, he is clinically tachycardic, pyrexic, slightly jaundiced, as we mentioned in the scenario. Okay, has generalized abdominal pain. Okay, but the abdomen is soft and lax. So generalized abdominal pain is a complaint here. So you're going to tell about the tachycardia. Okay, you are going to tell about the temperature, the pyrexia. You are going to tell about the jaundice, and you are going to tell that his abdomen is lax. This is your examination finished. Okay, the fourth point where you are going to the labs. All this is mentioned in the file, but you should say it in a professional way. Okay, fourth part is labs. What are in the labs there? The inflammatory markers are high. You are going to mention that high leukocytes, total leukocyte count, high CRP, and all the inflammatory markers are high. Okay, you are going to mention that his bilirubin is high or slightly elevated. You do not need to say numbers. You want to tell that the inflammatory markers are high. The bilirubin is elevated or slightly elevated or whatever in the results, but here it is elevated. Okay, and you have arranged the fifth point radiology. You have arranged an ultrasound and you found free fluid, right? Free intra-abdominal fluid, fine, and or intra-abdominal collection, whatever is mentioned in the file there. Okay, and we think that this patient has had a bile leakage. Okay, you have seen the leakage there and you think that this is a bile leakage from the drain at day 4 of the operation post-operatively, and now you are going to tell him that again. You are going to repeat that there is bile in the drain. Okay, and you want now the sixth part here and the most important part, that we were hoping to transfer him to your specialist care for definitive treatment. Okay, now we were hoping to transfer him to your specialist care for definitive treatment. Now you are telling about your failure and that you need help. Okay, so now you surrender to him. Well, at this point, the questions of the examiner or the consultant who you are calling will start. So the first question is, what are the possible sources of bile leakage? Okay, and you want to answer the questions because these are parts of the exam. Okay, you are going to tell that they may be due to cystic duct stump leakage. Cystic duct stump. You cut the cystic duct, as you know, so that is why it maybe your clips slipped or something. So cystic duct stump leakage. This could be a cause. You are guessing actually. Well, and you are going to tell that this may be due to slippage of cleavage or retained common bile duct stone, that you are trying to tell that the reason may not be you. Okay, the second cause could be a CBD injury, and this is an iatrogenic injury. Okay, the surgeon injured the common bile duct. Okay, another cause could be an accessory cystic duct, abnormal. This could be congenital accessory cystic duct, that the surgeon was working on anatomy and this is an extra anatomy. This is something additional, and he didn't notice that. And the fourth reason for leakage is a leakage from the liver bed, from liver bed. And this is the safest answer for you, okay? So that you are showing that your surgeon, your boss, did his best in the operation, but the complication happened, okay? Well, he's going to ask you the second question. What is the second question here? What will be your management? What will be your management? How will you manage this patient before bringing to him? Or when you found these things, what did you do? Okay, this is the question in another way. It's about management. Okay, so number one, you are going to start resuscitation, fluid resuscitation. Okay, with IV fluids. You are going to start antibiotics. Okay, you already started actually. You are going to tell that I resuscitated the patient with IV fluids, I started antibiotics, okay? And you are going to tell him that because in the file you will find the lab results old. And please don't try to tell something that is not in the file. If you do that, this is an automatic fail, okay? So in the file you are going to see the old investigations of this patient, okay? Old, maybe yesterday or something like that, okay? So you're going to tell that I'm going to order new set of bloods when I'm off the phone. I will order bloods. I will order bloods. Okay, and if this station showed up in the exam, the investigations will not be recent. You want to repeat them. So you are telling that I'm going to order a new set of bloods. I resuscitate the patient, given antibiotics, I will ask for bloods. Okay, and finally, here will come the reason of referral. Why are you going to transfer this patient there? We need to make ERCP. Okay, so ERCP is what he should do after that. And he's going to show that he's professional. This is you actually. You are going to show that you know already. And you want to do ERCP to delineate the source of leakage, if there is, and probably to put a stent if there is a need for a stent or there is stone retaining there. But this is not available in our hospital. So this one is not available. And in this way, in a decent way, you are telling the examiner or the consultant that is why I'm referring the patient to you. Okay. So the examiner is going to ask you the third question, and he's going to ask you, is it urgent, this referral? Nobody wants you to transfer someone to him. This is a responsibility. You release responsibility from you to him, and everybody is scared of responsibility, and this shows even in the exam. Okay, so is this urgent? You are going to say yes. Okay, why? Because this patient may develop peritonitis, biliary peritonitis. Okay, this is the reason of urgency. Fine. Now the last question in this station, he is going to ask you the fourth question. You see, only 4 questions are there. It is a very easy station, and all the stations of the phone call are like this. Okay, so he's going to ask you, do you need to arrange with anyone? Do you need to arrange with anyone? And this is a question that 4 marks actually. So you are going to say yes. Who are the people you are going to arrange with? Number 1, you are going to discuss with the number 1 bed manager. Okay, and you are going to tell that, because this is urgent, that you are going to discuss to create a bed for the patient. Okay, you need a bed. So you are going to discuss creation of a bed for him by facilitating discharge or repartitioning a patient. So you are giving solutions even in this and showing that you are professional. So after that, he's going to tell you that, yes, transfer the patient. This is the station finished. Okay, I'm going to see you in the next call phone station, and thank you for understanding and focusing. Okay, thank you.